Hello, everyone, and welcome to CCA's Medical Minute podcast. I'm Sherry Hughes, and this is our very first podcast of the new year, 2025. So happy New Year, everyone.
Happy New Year,
Happy
Sherry.
New Year.
Yay.
Thank you so much. We're going to kick this first podcast off by talking about something that I think all of us can use. It's mental health, emotional health, and wellness. And most people start thinking about the new year, making resolutions for the physical health, but I believe physical health goes hand in hand with mental health. So we want to talk about this for cancer patients and caregivers, but I believe everyone out there can benefit from this conversation. Joining me today from in-house is our Director of Precision Oncology, Andy Guinigundo. Hey there.
Hello, how you doing, Sherry?
Doing good. Glad to have you. And also a very special guest who answered the call, by the way, when I was looking for someone to have this conversation, Kelly Shoen. Hey there.
Hi, so happy to be here. This is so much fun.
Happy to have you. And Kelly is coming to us by way of Cancer Support Community of Greater Cincinnati and Northern Kentucky.
Yes.
But what I really love is she holds that role, but she also is highly educated in the field of social work, and a lot of what she has seen and over the years kind of speaks to what we're talking about here with the mental health and emotional health. So Kelly, welcome and thank you for being here.
Yeah, I've been at the Cancer Support Community for 16 years. Most of it, besides the last 3 years, I was overseeing our programs, using my social work hat and doing intakes and things like that, and saw firsthand, the distress, the anxiety of not just the person going through it, but also their whole family, especially the caregivers. And it's not always known that happens, and people don't always talk about it. So I'm so glad that you talked about mental health and physical health, because they really do combine and help us be the best versions of ourselves.
Exactly. And as a cancer survivor myself, it was one of the things that I think I tried to really walk in terms of my mental health, my emotional health. I try to be very cognizant of it, but sometimes you don't even, when it's you and you're going through it, you don't often notice things. But Andy, from your experience as a clinician, that's one of the things. You go in now and you get a checkup, and they want to ask you about your mental health and your emotional state of being.
Well, I think, from as we do it here, our appointments are all like at a desk. So from our side of the desk, there is that focus on, and the patients, with that expectation of, how are you going to help me with my physical health? How are you going to, cure my cancer or maintain my health? And, sometimes there's that tendency to kind of push that mental stuff. And it's like, how you doing mentally?
Yeah.
Good. Okay. Next thing, it's like, oh, it's checked off the list.
Yeah.
But it's not a check off the list. And, not even just the patient, as you point out, the patient is definitely because they've got this disease. But the other piece, though, is that caregiver sitting in that seat next to them. Sometimes they suffer in silence. That's hard.
And Kelly, you know what? Nowadays, every time you turn on the television or you hear a news program or anything, mental health is huge now.
Yes.
And more so what we should be doing to support one another and help people who are feeling, the anxiety, the stresses of just major, just life situations. However, when you're diagnosed with a debilitating or a disease that can be life-threatening, oftentimes it kind of takes it to the next level.
Oh, yes. So the universal challenges of a cancer diagnosis are loss of hope, loss of control, and unwanted aloneness. And it's not just for the person going through it, it's also their family members. And even if you have a huge support network, it can still feel very isolating. And I think people don't realize that. And so when they call us and we're like, no, this is normal, this is why we have a community, I think that sigh of relief is really like, okay, it's okay that I'm feeling this way. And you don't always have to be strong.
Right. You can be vulnerable, and you can tell someone, I'm not feeling that
Mhm.
well right now. And sometimes people don't really even know how to define it.
Yes.
They just know I just don't feel like myself.
Mhm.
And coupling that with the fact that you're going through a cancer diagnosis or treatment, and even I went add survivorship. I've run into
Absolutely.
many of those that are in survivorship from several years that are having issues, sometimes just by virtue of being a survivor.
Yes.
You know,
It's very complicated. And I will say through the years, the biggest phone call I get is when people are just done with treatment
Mhm.
because everybody is
Yeah.
clapping, supporting but that's when the person has time to think about everything they've gone through.
Yeah, after all the confetti has fallen.
Yes.
Like, think about like New Year's Eve, right?
Yes.
All the confetti has fallen, and we sung the songs, and then you're on your
Yeah.
way back home, and it's like,
Yeah.
Then
now what? I got to live the rest of my life.
Yeah. And I
It's
just
so-
went through this, but
yeah.
I didn't have time to process it.
So Kelly, and this is what we want to know now. It's like, what do we do? What do they do? How
Yes.
do we even begin to? We're having this conversation,
Mhm.
but someone is sitting there. How do they even know sometimes that they're not all together okay mentally or emotionally? It's not just if you're crying a little bit or you feel, like you might just feel like tired or you're in a little bit of a depression.
Yeah.
But sometimes it's a post-traumatic stress
Absolutely.
that can just linger and resurface.
Yes, because their body has done something and they don't trust their body anymore,
Mm.
right? So even if someone does all of the healthy things or not, it's that my body betrayed me. And how do you come to
Yeah,
grips?
no, it's
with
like,
that
like this is
piece?
your ultimate home, right?
Yeah.
Is your body.
Yes.
If your home was invaded, someone stole your TV. Now you don't feel safe at your
Yeah.
house.
Yep.
Yeah.
Well, here's this my breasts were trying
Right.
to kill me, or
That's
my
right. That's right.
my
Yeah.
colon
Say
was
that.
trying to kill me.
Yeah.
That's got to be
That's
the most
hard.
uneasy thing in the world,
Yes.
right?
Yeah.
And I
Yeah.
think that's why I love our model, because it's not just for patients, it's for long-term survivors, their friends and family members, because it pops up, right? Like scan anxiety right
Mhm.
before you go for your scans.
Yeah.
And
And people feel different ways about that, because honestly, I can't tell you that I don't have anxiety. I don't really feel that I do. Mine is kind of like the opposite. I almost look forward to
yeah.
to getting a scan, because my train of thought, my school of thought is, if there is something not quite right or if something is off, I want to know immediately.
Mhm.
So
Mhm.
I am like, okay, this is my way of somebody looking at me, being hands-on,
Yes.
and making sure that I'm okay.
Yeah.
So let's kind of drill down a little bit, and let's start by saying, what do you do? It's like you're a person and you feel that something's not quite right.
Mhm.
What with your mental health
Yeah.
and your emotional health,
I say check in with others, right? We have amazing resources here in Cincinnati with counseling, support groups, just getting connected to community, because I think that normalizes a lot of things and takes a lot of the chatter out of your head. Or you also end up having a big support network of people who understand what you're going through.
Mhm.
So that can look in many different ways, right? It could be being more mindful. It could
Yeah.
be counseling. It
Mhm.
could be group support. And we have a lot of different things. And what I tell people is not everything's going to speak to you,
Right.
right? Pick and try the different things.
Yeah.
Whatever works is great. And then I think that really getting yourself to relax. So mindfulness, yoga, eating well.
Oh, I love that. Yeah.
Because I've heard from so many people, like, I'm fine during the day. I lay down at night. My head will not turn off.
That's right.
And
Running
I can't sleep.
nonstop.
And you guys
So-
offer a lot of that stuff, like the
Yes.
yoga and stuff like
Yes.
that, don't you?
Which I
yeah.
love. And I love seeing people try things for the first time,
Mhm.
because we make it so comfortable that it's not like going to hot yoga or, you could be in a chair. Our instructors know how to do something if you can't get them up and off the floor.
Yeah.
Yeah. So,
So it's-
services. And again,
Mhm.
Kelly was with Cancer Support Community, and you guys do so much out there. And that's why I was so delighted when you said you would come and talk to us, and the fact that you're a social worker per se
Mhm.
as well. Andy, whenever a patient is in, can you often, because you're trained, you're a clinician, but you're trained to see things beyond just the what your discipline in precision oncology, whatever, can you notice almost off the bat when you feel like somebody might be a little bit more disconnected?
Yeah, I mean, I don't want to get too voodoo about it, but
right.
no, we really do have this. This, if you've been doing this long enough, um, and some people are better than others at it, but you almost have this sixth sense. It's like it's something they said that's completely. If you read the words on a page, would be completely innocuous.
Yeah.
But the way they said it, or the circumstance at which they said it, it's like that something's deep down going on. Or something they didn't say. It's like, well, they didn't bring this up. I wonder why they didn't bring that up, and that means something too.
I have I'm an advocate, and I often have been called the mentor of so many other cancer patients, not just breast cancer, and I get these calls all the time, and people want to talk to me all the time, and I really kind of sometimes feel like, this is overwhelming. You need to see someone.
Yeah.
I mean, it's hard to tell. You don't want to tell someone, you know what, something is really very wrong with you. Or that, you can almost sense a depression, or sometimes let's take it here, a fear that almost seems like it's crippling. It's a fear.
Yes.
Of I'm either not going to make it, or of my family can't handle this, or the fear for even some that are several years into survivorship.
Yes.
You know what? Is this thing coming back? Is it going to return? That's enough.
It's huge.
I always like to emphasize that, there's a point you like step over where, it's like, okay, that's something you're feeling, but now it's like, well, that's now a diagnosis. And someone has chest pain, and you work it up like crazy.
Yeah.
It's like, oh, is it a heart attack? It's like, oh, is it just reflux or whatever? And it's like, we've got to find the answer. Well, someone has, they're down and they're really clinically depressed. They're like, oh, they're just blue. They'll get over that. No, that needs every bit as much attention and emphasis as we did with that person with the chest pain.
So I like what Kelly said earlier about support. And I know that you all are heavily, in line with supporting the community and those in the community that have cancer, their families, their caregivers or whatever. So sometimes you don't know that something is okay until you get in a group setting and you realize that everybody in this group is feeling the same way or has felt the same way. Then, not to say misery loves company, because it's not miserable, but it lets you know that you're really you're not that bad. It's like this is kind of more normal, but you need to be able to get it out, talk about it. You need to hear others, and you need to be able to see maybe what somebody else has done or is doing.
We have a big philosophy of sharing wisdom, not advice, which I love, because people have so many different tips and tricks that can help others that we don't always know about. So
it's almost like having a new baby, right?
Yes.
It's like, I don't know. Do they always make that sound? And it's like, you don't know because you're a first-time parent.
Yeah.
And then as you get your second child or whatever, and like, oh, well, no, they're fine.
Okay.
That's right. It's very similar in that regard, in that it's just foreign. It's not something that...
Normalizing. Yeah.
Kelly, Chris just gave us the 5-minute time cue. So let's try to give some suggestions. I know you rattled off some of them earlier, but number one, you're not feeling like yourself. You should do what?
I would say get connected early. What we see a lot is people wait till they're really in a lot of distress. Because it's a lot, right? And especially the caregivers knowing that the support is for you. Studies show that they have even more distress, and people don't know that. And not everybody's asking them how they're doing. So it's okay for them to get support and say, I'm really struggling. We have amazing resources here in Greater Cincinnati. Everything we do is free. There's 150 programs a month, and there's a lot of different things to pick and choose. So example, we do parties, and it sounds fun, but it's also really easy to walk into a party and not a support group.
Right.
Yes.
To kind of dip your toe in, right? And see what it's all about. It's hard walking through the doors, but I think once people get there, they realize people are happy. We're,
Yeah.
they're connecting. Not
Mhm.
everybody's crying. I mean, you're allowed to cry, but
Yeah.
there's that full range of emotions.
And there are different needs for the actual patient that's going through versus the caregiver.
Yes.
Because caregivers, my goodness bless them, they really get it in a whole different kind of way,
Yes.
because now they're almost trying to help manage, if you will, the patient's grief,
Yes.
the patient's anxiety, the patient's depression.
Yeah.
And then they have to close the room door and go off and say, how do I do all this?
Yes.
I gotta help them with their food, I gotta take
Yeah.
them to their appointments. So even the caregivers.
And we specifically have 2 separate groups because the needs are different.
Yeah.
Mhm.
And not everybody wants their loved ones to know how much they're struggling. So if they're with a group of people that are just like them, it's a freedom,
Mhm.
right? To be like, yes, because nobody wants to worry their family.
Well, it's almost part of the problem, right? So
Yes.
you have to appear like, yes, I'm the wind beneath your wings kind of
Yeah.
I got
feeling.
this.
And so if you happen to be in the same group talking about, oh, I feel like I'm so helpless. I'm like, wait a minute, I'm helpless. You can't also be helpless.
I know.
One of us has to be the strong one. But again, for a caregiver, that is also normal,
Mhm.
and they need to know that too.
Yes.
Well, I want to thank you both for just kind of helping to broach this topic, as so many people are now talking about mental health and what we can do to support one another. And I want you all to know, if you're watching this podcast right now, that regardless to if you're a cancer survivor, or you're just getting a diagnosis, or you're a caregiver, or you're just someone in the community, you're just, if you're not feeling well and you're feeling like, there's a dark cloud hanging over me, or if you're feeling tired and anxious and you're snapping at everyone and you're crying and going through a range of emotion, you really, as Kelly said, you have to stop, take a deep breath. Let's take a deep breath. And you have to release it and ask for help.
Yeah. And it's okay.
It really is.
Yes.
Well, I want to thank you both for being here today, and we'll have more of these kind of conversations, and we'll get Chris to drop the cancer support community website,
Thank you.
hopefully in the body of this, so that if someone needs some help, Kelly, they will definitely know that they can come to you all, and it's all free of charge.
Yes. And if we don't
Yeah.
know it, we will
Find
give
it out.
them the right referrals to
And-
get what they need.
And Andy at Cincinnati Cancer Advisors, we're here to help advise.
Well, we help
as
the whole
well.
person, right?
Yeah.
Both mind, body, and spirit. We do as much as we can for all those things. So, yeah.
Thank you both so much. And thank you for joining us. Please share this podcast. Also, do us a favor and subscribe to it, and keep talking to your family, to whomever may need you, and sharing these experiences so that we can all live well.